8. Yes, who practiced in Abba Hospital? Yes. So what is the technique name this one? Figure of 8. So come to the sitting position. Or we can ask the patient to raise the limb. So this one, which side to which side, if there is a lateral ankle sprain, from medial to lateral or lateral to medial?
Medial to lateral.
See, the sprain will be like this. Okay? And the sprain is like this. So you have to apply from medial to lateral. So always start the point from the big toe, and as I told you, don't pull too much. The pressure should be. So if the patient is having lateral ankle sprain, medial to lateral. If the patient is having medial ankle sprain, from lateral to medial. See, again if I am doing taping like this, the ankle is going like this. So we have to do from the medial to lateral. Apply it. As I told you, don't apply too much tight and don't cover the toes. This is a wrong technique. Down the toes, and the first row should be reinforcing. First should be, you have to reinforce it. It is not like only one row. Then after that, half of the second row. Then half. See, this should be half of the second row. Then 2, 3. Okay. Once you come here, you have to cross the malleolus. Okay. And come down. 1, maybe 2 or 3 times. 2. Then 3 or 4, okay? Depending upon the thing, you can do it. And after that, again come down. See, it is not too tight. If it is again too tight, make it sure. Then off. Then okay. So it should be, keep the leg up. See that it is not too tight. Okay. If it is tight, you can check it here. So the some air flow should be there properly, and the remaining thing you can complete it. Okay. So see that some space will be there at the heel region, because when he is walking, it should not obstruct the bandage. So some space should be there here, and it should cover both the malleolus. Clear? So it is like a figure of 8 bandage technique, so that it is useful to decrease the amount of swelling. And again, when you are removing it, as I told you, don't remove like this. It is a wrong technique. Always when you want to remove it, you have to see that if you are not removing it properly, the elasticity in the crab bandage will go. So always the best technique is always remove slowly, so that the elasticity it won't go. And again, when you are applying crab bandage, see, there should not be any wrinkles. Okay. So this completes our management of the hip, knee and the ankle. See, if these types of wrinkles are coming, try to avoid it when you are doing it. Okay.
على ابو علي ازعل انا ابو علي هذا
Okay. So this completes our management of the, and as you know, what is the special test in the lateral ankle sprains is your lateral inversion test. Patient will be in supine position, hold one ankle at the upper end, and the other hand at the door and apply inversion pressure. When the patient complains of pain in the lateral side, it is the lateral ankle sprain. So the ligament is our calcaneofibular ligament. See, this is your calcaneum. Okay, this is the fibula bone. So the ligament will be like this. So when this ligament is ruptured, so try to easily remember is calcaneofibular ligament.
Palpation.
For eversion, you have to do the eversion. For eversion, do eversion. If the patient complains of pain here, which ligament? That is our deltoid ligament. Here is our calcaneofibular ligament, and medial side is our deltoid ligament. So this completes our examination and the treatment. So prepare for the exam for the 1st May. Clear? And for the 5th May, your final lab. 1st May is your second continuous assessment, your elbow, wrist and hip, and knee, ACL and PCL. Okay?